Good morning, everyone. I think we can get started. I believe that we have everybody in person who was out in the waiting room having lovely conversations. And it looks like we have several folks online. So with that being said, I think we can get started with the meeting. I will call it to order. We do have a quorum. I can see that very evidently, so that's fabulous. And then if I could just move on to the agenda approval. Do I have a motion to approve the agenda as it stands?
I'll move.
All right. And do I have a second?
Kristen Amundsen, second.
Fantastic. All in favor of approving the agenda as it stands, say aye.
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 Aye. Any opposed? Okay, seeing no opposition, the agenda is approved as it stands, and we will move on. All right, so approval. Oh, it's okay.
Sorry.
Jared was saying something. I was like, oh no, I missed something.
Good morning, everybody. This is Dick. Can anybody hear me? Everybody hear me?
Yes.
I can't hear you.
Oh no. All right, Jared is going to work his magic because he's amazing. And hopefully you will be able to hear us. The next item.
If we could, can anyone else, just to guarantee, just to diagnose, can, like Diana, it looks like you unmuted. Can you hear us?
This is Diana. I can hear you.
Okay, so we're trying to chat with Mark, but it sounds like it's more on his end, unfortunately. Dick, sorry. Dick, sorry. Okay, sorry.
No, you're fine. Totally fine. All right, so then we will move on to the approval of the minutes from the May meeting. Do I have a motion to approve the May meeting minutes?
This is Diana. I move to approve the minutes.
Fantastic. Do I have a second?
Second.
Okay, and Lois seconds it. All right. So we have a motion to approve and a second for the meeting minutes from May. All in favor of approving the meeting minutes from May, say aye.
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 Any opposed? All right, seeing no opposition, the meeting minutes for May are moved and approved. Fantastic. We are moving right along. Yes. We certainly can. Yeah, we can do that now. Absolutely. We'll go around and do introductions. Fantastic. All right.
Hi, everyone. We can't see you online, but good to have everyone here. This is Kristen with Goodwill. I wanted to introduce Daryl Holtzlander. He is our new transportation manager, and I'll let him tell a little bit about himself.
Okay, I worked in the same type of program, nonprofit in Michigan, West Michigan to be exact, and Central Lower Michigan, and the nonprofit, obviously. I come out here with a little bit of experience, a lot more experience than I thought I had, but and we're looking to grow the program a little bit more and into the community more, and we want to provide more, actually. So.
Fantastic. Thank you. And with that said, I think we can kind of go around the room and do some introductions, and then we'll touch base with our folks online.
Laura Cruz, Mobility Coordinator for PPACG.
Lois Landgraf, representative from the Resource Exchange.
Got it. Okay. Mary Wagner, Cripple Creek Transit.
Diana Rumsey, the Independence Center.
Hello.
Good morning.
So Melissa Martz with the Pikes Peak Area Council of Governments Area Agency on Aging.
Fantastic. All right, so online, I've got Mark. You want to introduce yourself?
Yeah, this is Mark with Fountain Valley Senior Center, and we're up and running, and I'm looking forward to serving more seniors.
Fantastic. Paul, you're up next on my Zoom.
Paul from the Independence Center.
Fantastic. Luke?
Yeah, this is Luke Kerr with the Town of Monuments Planning Department.
Fantastic. Dick?
Good morning, Dick Hyde with Community Intersections.
Excellent. I think the C is Chelsea.
It is morning, everyone. Chelsea Gondek. I'm with the Colorado Springs Downtown Partnership.
Excellent. Jacob?
Hello, everybody. Jacob Matson. I'm with Mountain Metro Transit, and a little bit of an announcement. Some of you might be aware, but probably most of you are not. Our planning supervisor, Dave Mentor, will only be with us for another week or so, and I will be transitioning from the ops supervisor here over to the planning supervisor. So don't intend on leaving this meeting quite yet, but in the future there may be some changes. But for now, I'll still be the representative for Mountain Metro Transit.
Fantastic.
Congrats, Jacob.
Thank you, Laura. I don't know if you had heard or not, Laura, but words been getting around a little bit.
I got the 411 this morning from our team. So
cool.
Congrats.
It'll be a fun, nice change from I've been in operations for 7 years and I did 5 years of planning before. So I'm excited to get back into planning.
Yep. Happy to work with you.
Likewise. Thank you.
I was looking to see if I could see any more of my Zoom buttons, but I don't. But it says I have 9.
I'm trying to go off of memory.
Okay.
We introduced Diana, right?
No, not Diana yet.
Good morning, Diana Van Auken, Director of Transportation, Teller Senior Coalition.
Fantastic.
No, I think that's all going off of memory. But if
Okay.
there's anyone else, they're all members, so if we've missed one, speak up now.
Absolutely. Okay, fantastic. Yay, we did it. Okay. Do we have any public comments or presentations? It doesn't look like it. Oh, okay. All right. Any action items? Any membership appointments this time?
Not this month, but I think that Kristen has been talking to Daryl about potentially officially joining the MCC as a representative for Goodwill. So
that would be amazing. We would love to have you. All right. Community guests and provider presentations.
I had intended to have Dr. Cog come to visit our meeting today. They were not available, but I will give an update a little bit later in the next number 8 on the agenda. So
fantastic. All right. Well, with that said, we will move on to number 8.
Oh, great. Wonderful. I'm going to kind of skip. I'm going to put B in front of A because B is a much smaller conversation. I don't see Glenn Krause on the line from CDOT, but just wanted to get a idea from those that are in the virtual room about y'all's progress with contracting with CDOT. And any questions that you may have that I may pass along to them regarding the current NOFA that's out there. I have been in talks with CDOT. There was some confusion, actually, I believe with good. Oh no, it was Second Home. I don't see him on today. Some confusion around agencies out of El Paso County applying for I can't say that word. I'm from the country. Rule 5310 funds. See, it doesn't even account for it here in the little anyway. So those Rule 5310 funds that are available through the current NOFA for admin and operating, there's been some confusion on CDOT's part of knowing whether our agencies in El Paso County are eligible for those because PPACG administers the urbanized 5310 program. And so I've been doing a lot of education with CDOT. Many of you guys know that there has been a lot of turnover, and so new people, new things for them to learn. And so for those of you who have or are thinking about applying for admin and operating through Rule 5310, if you're running into any issues with CDOT in communicating what you're trying to do with that funding, if you're coming out of El Paso County, let me know. I can help educate them. A lot of them do not know that El Paso County is a big county and we're very unique where we are not a full urbanized county, which is something that they're not really used to up in Denver because most of them reside in Denver, and that is a fully urbanized county. But El Paso County is split amongst urbanized, a small urban, and rural, which is very confusing. So it just depends on what funding you're looking for and the locations that you're trying to serve. So I know that we've had some questions from agencies as to whether they would be eligible to do 5310 programs in places like Calhoun or in even going down to like between here and Pueblo. Those are eligible expenses, but there is a confusion at the state level as to whether that is. So let me know if I need to help intervene on that. There's also been questions around CDOT as to why they did not do a super call this year. They just did a NOFA during this time for admin and operating, and it does not include the capital. So the reason for that is they are prioritizing admin and operating because they want to make for sure that wheels stay on the road and people are being served. That you have seen that probably through the contracting process. Your capital projects and your capital contracts are probably lagging more behind than the admin and operating that they have been so far behind on. So they are prioritizing that, and instead of doing a super call, they right now have out the admin and operating funds available. And then later, closer to, I believe, September, October, they will launch the NOFA for the capital expenses. So just that's kind of the update of what I know of what's going on. Obviously, Glenn is your contact in our area. So if you're also having issues connecting with him, please let me know. So. All right, CDOT update. We're going back to A, and this is really a discussion for this group. We talked a little bit with the executive committee, a couple of things that have been coming up a lot lately. And in terms of challenges for those in the community trying to navigate how to get to certain places. And one thing in particular that's a hot topic right now, it's always been there, but it seems to be more prevalent, is the challenge of getting individuals from Colorado Springs to Denver, specifically for medical appointments or even for jobs. I've had several seniors over the past couple of months contact me saying, hey, I have a regular appointment in Denver that I just can't get to. And I don't qualify for Medicaid, which makes it really difficult for me to find transportation up to Denver for those appointments. And so I wanted to kick off the conversation today with those in the group with initial question of, is this something that you have seen more prevalently in the past year or so of individuals needing that type of transportation? Have you been able to navigate any options for them? And if not, what are some of the gaps that we could fill in as regional partners with other agencies across essentially across the lines of the PPACG area and this group in order to serve those individuals? So wanted to kick off the conversation with those two questions, and let's go from there. This is a cool group. I can say Bueller. Okay, let me rephrase this a little bit. I think Lois has something to say though. I just saw her move forward. Okay. Let me rephrase this a little bit. If an individual comes to you, like each one of your agencies basically has intake people, or you call them receptionists or you call them dispatchers. If an individual comes to you and says, hey, I need transportation to Denver for a doctor's appointment or a job, do you have an option for them?
Laura, this is
Yep.
Diana.
Yep.
So in our area, we do provide transportation down to Colorado Springs to connect with Mustang to get up to Denver. But that's usually to the airport because they can be connected at the airport. It's the last mile connection of how they would get to a particular provider's office, which we're more than happy to work with any other organization to make that connection. We have also in the past referred to Invita, and Invita can talk from their end on that. I'm not sure how much transportation they're providing directly into Denver. So it definitely is a challenge.
Great. Anybody else on the line that is kind of been pondering this or has been running into any issues with this and doesn't have an option?
So I
Laura-
think, oh, go ahead.
Laura, this is Mark down in Fountain Valley.
Yeah.
We have not had that question asked. And it's definitely something to think about. We have not discussed that. We have not, that has not come up in a conversation, but it's certainly something that that would need to be discussed, I suppose. Usually, you know, if folks say that they do have appointments up in Denver, they do have somebody, a caregiver or a family member that is able to take them. So I guess in a sense we've somewhat lucked out. So that's my input on that. But we're certainly open to that thought process and possible solution.
So Laura, you and I had this conversation, and the only thing that comes immediately to my mind is the veteran directed care that comes through the VA, because there is an option where their caregivers can transport and then get reimbursed for mileage. I will also say anecdotally that there is some research in rural programs where they've created essentially travel vouchers where they can then draw on a pool of funds, and that person can take essentially, you know, that travel voucher and pay a caregiver or a neighbor or somebody to transport them. And then that person can then get reimbursed through transportation funding. So just to kind of let you know that anecdotally, there have been programs like that have been successful, and there's some really great review and lit on that.
Yeah, we talked a little bit about roles in navigating these types of situations with individuals that have these special needs. And what's the role of you guys as agencies that are managing sort of the day-to-day of services in our service area? And what's the role of your dispatchers or receptionists in helping individuals that navigate, that need services that you don't provide? How are you referring people to different services to fulfill these needs? Actually, most of the calls that I've had lately have been people needing to go to Craig Hospital and people needing to go to the Jewish Health Center. And so those are, we know that the VA has been a problem. Like, VA has been a real challenge. There has been a super challenge with the VA in particular, that they depend upon volunteers to do pretty much all their driving, and they don't really have the volunteer base to do that. So those buses and vans that we see up on Fillmore are not really moving. So that's an added need. What we've been running into is the Medicaid folks. They really have a lot of options. It's those that don't have Medicaid that it's not a feasible, especially if you need an accessible vehicle, not really a financially feasible trip. We've checked into it actually through some agencies that provide private pay options. And it's around $400 for a round trip up to Denver, especially if you need an accessible ride. And I have Goodwill shaking their head right here. It is. And so I've been in talks with Dr. Cog as well as Dr. Mack, which is the Denver Regional Mobility and Access Council, about different solutions that I wanted to share with the group today, that ultimately we all, as this group and their resources up there, have to play a part in. But I think it's important for us to know what options are out there, what are the limitations of those options, so that we can communicate that well to folks. Currently, Diana mentioned connecting people to Bustang. Bustang is an accessible resource. So they actually will transport individuals who may need wheelchair assistance, but it still has to be an individual that can navigate getting on a bus, getting to a bus, then transferring to a different type of service once you get to Denver. And I've been talking through this with actual customers, clients, however you want to whatever you want to call them at this point, individuals, that's the better term, who are in need of this type of assistance. And the fact that they have to navigate transportation to Bustang, and then from Bustang go up to Denver, and then navigate transportation, sort of that last mile of that, it's a difficult trip, right? So some of the solutions that I've been talking through with Dr. Cog and Dr. Mack is utilizing Bustang as a resource, but we really need agencies on the MCC to help with that first mile connection, right, to Bustang. And maybe Diana, you can talk through sort of how you guys have made that connection and navigated that from our end of the trip to getting people to that resource. Putting you on the spot, Diana, but how have you navigated that for people?
No problem. So our staff, recommends, and it's clients that are able to make that connection and be able to make those arrangements. And so we haven't specifically, set up their connection. They set up their connection, and there's multiple places in Colorado Springs that they can catch the bus. And they set that up, and then they coordinate, that transportation where we take them there and drop them off. So it does take someone that has the ability to figure that out, unfortunately.
Yeah, so, and what you're describing is a little bit of the solution that we came up with that is definitely not perfect for those that really struggle with, that would really struggle with navigating this. But, so Diana's describing if an individual, and this is also a trip that can be paid for under, multiple funding sources like AAA, 5310, this is kind of a type of trip that it is an eligible trip. I just want to put that out there. But being able to, an individual being able to call you, access you for that first mile trip to connect with Mustang. And here's the end of it, right? So this is what I've been talking about with Dr. Cog and Dr. Mack is Dr. Mack actually has a, they have an app, but they also have a one call number up in Denver that our folks could be accessing to be able to call and connect with a transportation provider up there and make a direct have a direct conversation with that transportation provider to pick them up from the Mustang stop and take them to that last mile location. Again, what's not perfect about it is it's basically 4 transfers to and from there. And so we do have that as a resource to be able to say to an individual, okay, I can get you to a Mustang stop, but here is the resource to connect that second leg of the trip up to Denver. I think one of the larger conversations that I'd like for us to have in having Dr. Cog and some of their agencies attend this in the future is talking about how to make that a little more seamless for an individual, right? So that they're not having to call Diana and set up their first trip and then try to call another agency to set up their second trip. And what do you do if one of those providers, if Mustang's late, how do they communicate to make those things happen in a more seamless way? So when I talked about roles, I know that your dispatchers are really probably overwhelmed by the number of requests of just rides within the community here. So I want to offer up PPACG, myself, some of our, hopefully I can train a few of our other staff members, and we're also getting a volunteer coordinator through the VISTA program here at PPACG to help with some of those navigations of those complicated trips. So if it's something that is outside of your realm of being able to have that long conversation with an individual, trying to get them set up from the first mile to the last mile, we are happy to help navigate that for the few that may need that. This kind of leads into travel training in the future. That is something that's important that PPACG is looking at, because we recognize that some of these trips are a lot more complicated than just a one-way, easy peasy one trip. So wanted to kick off that conversation. Wanted to just say that if somebody is calling you guys and requesting some of these types of more challenging trips, that you guys kind of a call out to y'all to help coordinate that first mile. And we'll try to work with you guys. PPACG will try to work with you guys to help coordinate that middle leg and that last mile. So I have an individual in particular that called me the other day, and luckily she was trying to set up a a ride for December and not tomorrow. Yeah, I know she's really thinking forward about that. And most of the time it's like, oh, I need a ride next week. And I'm like, but we do have an option. I would like to connect her with one of our agency partners that is on this call for that first mile trip, then get her connected with Bustang and get her connected with a provider up in Denver. So that's something that PPACG, myself, was going to try to work with and also track how many of those requests that we typically have, so that we can kind of get that going. So I talk a lot about this from a medical appointment scenario. There's also some options for folks that may need to go to Denver for work. And a couple of those options, and Jacob's on the call today, a couple of those options that are available that I want to bring to light is busing is something that is available to go to work. I believe in our area, they start their rides at like 6:15 in the morning. There are several time slots that they leave for go through Colorado Springs. I think it's like close to 8 times that they're coming through Colorado Springs and going up to Denver every day. And so they try to hit to be able to help out that traveling the job type of trip for folks. They actually drop off people right in front of the Capitol, right? It's kind of cool. I rode Bustang up a couple of years ago to a Rockies game. It was a great experience. I mean, how many times do you get to go on a bus that you have your potty attached to you? It was nice. And so I think that's an option for individuals that are trying to figure out some work options, especially if you're having to go up there for a couple of meetings a month. Secondly, if you know individuals that are traveling, maybe to the Castle Rock area, Littleton area, Denver for work. Jacob's on the line. One of the things that they're trying to promote is their van pool program. And van pool's super cool. Essentially, you get to take your colleagues that you may be traveling with up to Denver in your own van, and have your own transportation that is A, reliable, and B, particularly cheaper than what you would be doing in commuting. So more information about that in the future. I know that Mountain Metro is looking at kind of how to explain van pool to people. Right now, the information that's out there is kind of confusing. There's a lot of rules around van pool, I think, that can be simplified in terms of communication. So that's an option. So I feel like sometimes that these meetings are just me. So I hope that we can in the future kind of talk through some of these different scenarios. And I appreciate those that have talked a little bit today about some of these different challenges that folks have experienced, but also some of the things that y'all have been doing to help overcome some of these challenges.
Laura, this is Melissa.
Yep.
So as we are looking to grow the volunteer program with the Area Agency on Aging, I've been making some phone calls around, talking to some different organizations across the state. And I came across an organization that's a volunteer-based kind of coordinating program up kind of on the northwest side of the Denver area. And part of their volunteer program is to literally drive older adults and people with disabilities across the region. And so they have explored that and kind of put that into place. And so it's interesting to know that there is kind of an organization out there, again, up in the, kind of metropolitan, outside of the metropolitan area, that is dedicated to having those types of rides available with volunteer drivers. But they do receive some AAA funding for transportation as well. I didn't get a chance to, dig how deep into that they have, but they were just really talking about their volunteer base and how they are driving people, long distances to get to doctor's appointments. They also talked about how hard it is to find volunteers. So we know that kind of going into it in terms of everybody on the call that relies on volunteers, that, just finding volunteers in general can be a real challenge. But I thought that was interesting that, and I'm drawing a blank on the name right now. I think the name is Cultivate, but don't quote me on that. And I will be bringing that information to the executive committee when we meet next time.
Cool. Awesome. Any other thoughts and comments on this conversation? What I'd like for us to do is periodically, as we come up with some, issues that we may not have solutions for, with customers that are calling us, that we bring those issues to this group and talk through some potential solutions. We may not come up with the best solution, but at least we can come up with sort of standardized solutions that we can communicate to individuals. I think that's important. And I hope that as you may get these types of requests from folks, one of the frustrating things that I'm dealing with right now is I don't understand why doctors are referring people to medical appointments in Denver without coordinating some sort of transportation. So I think there's some opportunity to loop in some of our hospital folks and whatnot to start that conversation of, hey, the service is very complicated to be able to, for a senior or an individual with disability to be able to navigate. So stop referring them to places they can't get to. But anyway, I just want to say, if you guys have requests from folks that may need this type of assistance, that we work as a group to help make that work, at least on our end, right? We want to make sure that we're coordinating with each other to ensure that there is that first mile transportation that we can connect in with our regional transportation partners. So, yeah, that's all. If anybody has any more comments on that.
So I was, sorry, I was just waiting for you. So I was just going to say, to your point, so hospitals and large hospital systems have community benefit dollars that specifically are supposed to be addressing the community health needs assessment categories. So I think, to your point, there's a really lovely opportunity for us to have conversations with them and really talk to them about how transportation and transportation challenges do fall under that community health needs assessment component and could absolutely be used from a community benefit dollars. And even if they set aside, $5,000-$10,000 a year strictly for transportation, I mean, in terms of their budgets, that's a very small drop in the bucket, right? Yeah. That's not a lot of money when you're talking about hospital organizations that give out $1.5 to $2 million in community dollars and sponsorships a year. So I think that there's definitely an opportunity for us to have conversations. I would love to kind of explore who those people are that we can kind of get in front of to be able to have those conversations with, who is holding those community impact fund dollars for those hospitals and how can we get on their calendar?
Yeah, and most hospitals are required to do that community health needs assessment. Large ones, it's almost every year. I participated in a lot of stakeholder engagement with those planning processes in Chattanooga. So I think, Melissa and I can do a little bit of digging on figuring out how to get on those people's radars. If you guys also have connections there, I think that's important. I think data also helps us. So if you have any kind of data that you're tracking around this issue, I think that would definitely help us with the conversations with the local hospitals to try to navigate some better solutions and resources for this type of work. Yeah, great comment there.
All right. Is that all, Laura? Because then we'll do kind of updates from everyone.
Yes.
I don't want to I would be remiss if I didn't ask for everybody's update. Okay, so we will start with the folks in the room and then we'll loop in the folks online. So we will start with Kristen.
Hi, everyone. We're having a big open house for Possibilities, our day program on July 19th. And so we have some flyers out in the lobby. I've been kind of running around town and we're trying, excuse me, to also highlight our transitions program. We have a transitions program for young adults coming through the school system that are ready to graduate. And as I'm told, is paid through the school. Transportation, all of that stuff is typically covered in the schools. And they can come to our program throughout the year and they go out in the community and do different things for job training. So we're trying to highlight both of those programs. It's like an ice cream social open house and tour our day program. And yeah, we're looking forward to next month's meeting too, to kind of talk about day programs. We've been exploring some stuff with Daryl. So thank you.
Y'all have heard enough from me.
All right, then we'll move on to Lois.
Thank you. Lois Landgraf, the Resource Exchange. I think the only thing I really have to report, I'll let you talk about your idea, is that we have a change in our board. I'm going to be chairman or president, I don't even know what it's called, of the Resource Exchange Board. So I think I'm going to be looking for a replacement for me on this particular board, because I want to continue on with the legislative role that I have there. So that's it for me. Thank you.
Mary Wagner from Cripple Creek Transportation. I have nothing new. Everything's going well. Thank you.
Fantastic. So Diana Rumsey from the Independence Center, just to kind of remind folks that in next month, we are in June. Next month, we will having our festival at the Independence Center where we celebrate the signing of the Americans with Disabilities Act. We'll have lots of different vendors. If you're interested in having a table, if you're interested in just kind of coming down and having a good time, please absolutely connect with us and we will get you all of that information. We'll be sending out kind of an email blast and an email invite as we get closer. And so I think that's about it. And then as Lois alluded to, we were talking about kind of amplifying some of the policy messages coming from the Pikes Peak region. So if anybody has an interest in delving into the policy side, we are more than welcome to have those conversations on how we can prepare people to talk to legislators and really look at bills and kind of discuss some of the implementation side of things and have a really diverse voice at that table so that we're able to really look at things with a holistic lens so that, you know, good bills get passed and bad bills don't. So I'll open it up to the folks on Zoom. I'll let you kind of popcorn around and speak up as you like.
This is Diana from Teller Senior Coalition. So we were just awarded, budgeted our MMOF funds, which, I know, I'm so excited, which includes adding 5 deviated bus routes throughout Eastern Park, Teller County, and Western El Paso County. So we have already put in place our Southern Teller route, and we're seeing a lot of ridership coming in from that. So we're excited to get the other 4 going. This included also purchase of a transit van, and unfortunately that's all been delayed. So our van we're not expecting until the end of the year. And then we also have another transit van that was approved last year that we haven't received the budget for at this point in time. So that one's going to be delayed. So that's our biggest challenge right now is lack of vehicles. But PPACG has set aside some grant funding for us for 2 vehicles. which we're really looking forward to. Hopefully, we're looking at that in July. And we're also in the process of hiring another driver and another scheduler in the office. So we're just growing rapidly and trying to keep up with the pace.
Thank you for that. Who would like to go next?
I'll go next, kind of along a somewhat similar vein with the vehicles. So we recently received award notification for a low-no grant in the amount of 3.2 million, just shy of 3.2 million. And it's to replace 6 of our old diesel buses with hybrids. So the buses we're replacing are 2006s and 2007. So those are some old buses that are ready for retirement. So that's kind of the exciting news from around here in the last couple of days we found out. So
That's awesome, Jacob. Congrats.
yeah, we need to get our fleet taken care of. We got some old buses in there that we're looking to get retired. So this is a good thing. Only problem is it takes about a year to get a bus. So
Yeah.
Jacob, where do old buses go to die?
oh, anywhere from depending on how much value is left. They pretty much don't sell for much. We may look to auction them off. That's always a possibility. These, I mean, if it's kind of a weird rule with FTA, if we get, I think it's $5,000. If we make it, we get $5,000, we have to pay back the feds. So if it's less, we keep it. But yeah, they pretty much these buses are they're well past their useful life. We're potentially looking to maybe take parts from them if they're adaptable to other buses, but at that age it's hard to find that. So
Well, and I jokingly ask, but I did drive by an old bus graveyard the other day on the southeast part of Colorado. So I was just kind of curious. It's kind of sad to see, but just was wondering.
there's actually an old Metro Mobility vehicle that's in the neighborhood, kind of adjacent mine, about a quarter or about a half mile, 3/4 mile from where I live. And I see it almost every day coming home from work. And I can see the old Metro Mobility sign kind of, wiped away from it. So someone bought it.
We should open like a take all the old buses and have like this really cool sort of restaurant area, turn them into restaurants. Like, yeah, I think that would be cool. Southside, let's do it. Let's do it.
You got that plane out there on the east side, and
Yeah.
Airplane restaurants.
So side note I'm originally from the Midwest. And I'm not from Indianapolis, but I was in Indianapolis years ago. Stayed at a hotel that was an old train station, and they had the old train cars and had like the whole setup there. It was a really cool place. And so that's kind of a neat little thing. I don't think you could do hotels with buses, but it's a interesting dynamic.
I have my next gig.
There you go. Entrepreneur.
Yeah, food court using old buses. All right, let's.
Well.
Yeah. Yeah. Yeah, and buses. So weird aside, when I lived in Tennessee, out by our camp, there was a bus bar. It was a bus that they had converted into like a bar and a concert scene, and they had really good concerts there. It was kind of cool. So, all right, if none of our transit jobs work out, we know what we're gonna do. Yeah. Anybody else? I think we have some more. I can see Sagan is on here. I don't know if you can see them.
Hi, this is Sagan over at Invita. I do have some news to share just regarding our on-demand pilot program. So we're in the process of wrapping up our current contract, and it ends June 30th. But Invita is really excited to be extending our contract. Laura at the PPACG reached out to us and said that they're wanting to work with us towards our program. And I know a lot of our participants are very excited about that, just with what the program has been able to offer them with, you know, extended hours, weekend availability. It's just been very convenient for them. We've received a lot of positive feedback, so I know a lot of our participants are happy that we're extending our on-demand pilot program.
Yeah, thank you. Invita's done a really good job taking on this grant, so I really appreciate. It's been a little bit challenging figuring out how to integrate an on-demand type of service into their demand response type of service. And so they've basically been testing out the waters for us over the past 8 months. And we're set to, it's really picked up towards the end of the grant period, but we're set to provide 550 rides by the end of June 30th. So that's really cool. Um, some stories that we've heard from folks is they've been able to go to a shopping center and go to 5 different places and get, you know, their nails done and things like that, that, you know, we take for granted for those that are mobile, and they just haven't had that opportunity. Most of our transportation, and it's kind of driven a lot by the funding, is for medical appointments, and we kind of lose sight or also struggle with finding resources and whatnot to help with those just everyday cool stuff, right?
So how does a person access that?
That's a good question. So we've kept it small. Okay. We worked with the Independent Center and a couple of other organizations to identify individuals to enroll in the pilot program. We've had to keep it small because of just limitations in terms of Invita's operational capacity as well as funding, right? These rides are kind of expensive for us, right? And it's not because Invita is charging us a exorbitant amount beyond their expenses. It's because they are expensive. And so I think one of the things that we're going to do is learn from Invita. Sagan's doing a great job of kind of working with Eric, their operations person, to put together a roadmap for other agencies to kind of think about this type of work. We recognize one of the big barriers is actually software to be able to integrate different types of modes into a software system. And so that's actually something that PPACG is looking at potentially in the near future, sourcing for multiple agencies to participate in, just so that we can help provide that resource to our agencies to have that integrative network, so that they can figure out how to have the tools to do demand response and on-demand transportation. So to answer your question, Lois, right now we have I think Sagan said yesterday, 78 people enrolled. Is that correct? Right. Okay. 78 people enrolled in the program. They're all in El Paso County, all in the Colorado Springs area. We put some boundaries around it. So people can request a ride within a 7-mile radius of their location. And all of these kind of boundaries are back to capacity, right? We need more capacity type of tools to grow this type of work. But what we're finding as a national model, and this is a hard thing for some of the folks on the call, I know, to kind of think about, but on-demand transportation has been tested a lot across the U.S. in the past past few years. And a lot of transit agencies are transitioning a lot of their transportation to on-demand because they can be more efficient with it. So while you have your scheduled routine trips, right, those kind of subscription trips, these trips that currently aren't really routine, like, wanting to go get your hair cut, that kind of thing. right now they're having to run through a demand response system. And that means that individuals having to book that ride like 2 weeks in advance or whatever your booking window is. And so, they may find a ride between now and then that's quicker, right? Or B, you have other cancellations during that time period. This actually frees up your vehicles to be more mobile to provide rides on a regular basis. You're fulfilling a need quickly, and you don't have as many vehicles sitting between appointments and those types of things. Because I know with doctor's appointments, you guys have a set time of when you're trying to get them there, but they're calling you for that pickup, right? And so you don't necessarily have a lot of control over that, but you have a vehicle that is kind of sitting there trying to, not necessarily sitting there, but trying to work that second ride in. But if you're looking at a more on-demand type of model, you have less of that sit time, right? So I would like to bring in the future some agencies that actually Melissa and I were introduced to in DC and have been working with NADTC, the National Aging and Disability Transportation Center, our grantee group. Some of them have been doing on-demand transportation for a long time, and they would be a great group to learn from how they've integrated this and what it means to them and how it's actually helped them with their efficiency of providing services. Long story short, if you want to connect someone to the program, get in touch with Sagan. Just know that it is a limited amount of people that we're serving at this point.
And Sagan is with
Invita.
Okay.
I would like to speak about this on demand.
Yeah.
I just like everybody to know that the people that are using it, it really opens the doors for them to get out in the community more and not have to worry about waiting for a ride down the line. So they're able to just call up and get on and book a ride later that day or whatever it may be, and then go somewhere and then be able to call again and go somewhere else and go. They can get many things done in one day compared to getting one thing done that takes 2 hours or an hour and a half or whatever. So this has been a big help for those people that are being able to use it during this pilot program. And I like it.
Thanks, Paul. And I appreciate you speaking up because you are a participant in our program, and I think it's important. I'm throwing you on the spot a little bit, but I think it's important for folks on this call to truly understand what this means to people. Sometimes we're just tied up in operations that we, even myself, get a little bit lost in what the actual needs are of individuals and how we can serve them in a better way. So I really appreciate just kind of hearing your input and how this has impacted individuals.
But I'm going to put it a little bit more in perspective. I have a vehicle, but it got totaled and I got stuck at the house and sitting at the house and then going, oh, I would like to go to the store just on a split second. You have that capability with this. Whereas, well, I'm making dinner and I need to get some salt, but I got to wait 3 days down the line to go get it. You know what I mean? Because you're making an appointment. With this on demand, you have that chance to make that sudden change to go to the store, or your friend calls you up and says, hey, let's go out to dinner or a movie. I could do that in 3 days. But on demand gives you that opportunity to go do that.
I know this is, kind of a amazing and out there idea to have on demand. And as Laura mentioned, oftentimes it actually is easier and better than the scheduling system. And it makes me think about in hunger relief when food pantries, the way they were organized was everybody had to come in and they all got the same box of food. And the way food pantries operated was, they had 100 volunteers, they'd all bag up these huge boxes, everything was the same. And many years ago, they started kind of doing an upheaval in food pantries where they wanted to go to client choice. And all of the food pantries around the country said, oh, it'll never work. It'll take too much time. And you look at today, and every single food pantry across the country is a client choice food pantry. Hardly any of them do these boxed, programs anymore. And so this whole on-demand piece, even though it is daunting to think about and hard to believe that it might be an easier and more efficient way to operate, it'll be interesting to see what happens in the next, 5 years. And again, it really does turn things upside down, but I think we might see some real significant changes. But stay tuned. And I'm just going to remind, if Deanna wasn't tracking, we still have 2 people to give updates. So anyway, I'll get off.
No, thank you for that. I appreciate that. So who would like to go next to give an update?
Chelsea too.
I don't have anything.
Okay,
It's
Chelsea's
back to
good.
work day. I mean, tomorrow's back to work day. So,
Okay. Would the City of Monument like to give an update?
Yeah, really the only one I have is that yesterday was our Director of Planning's last day. So we are currently functioning with just a Planner 1 and a Planner 2. Yeah, that's really the only update I have. We're struggling a little bit, but we're trying to get through it.
All right. And the City of Fountain. Okay. Dick, would you like to give an update?
I'd love to, but I really don't have anything to update it, except we're expecting 2 new vehicles to come in. Anybody have an idea when they're gonna get here? Besides that, that's what we're waiting on.
2026. I'm just kidding.
Oh, when they said April, May, but they didn't say what year. So that's my current thing, so.
Well, I hope they arrive soon. All right. Is that everyone? Did we leave anybody out on the updates? Okay, seeing none, we will move on. So it looks like items for the next meeting are, as Kristen had alluded to, the day program transportation. So we look forward to having that conversation. That will be exciting. And seeing no other business.
I have actually for day program. This is something that came up back when Dave Summers was our chair. We were talking about different pain points for agencies and being able to provide services. And so one of the things that came up that we haven't quite tackled as a group, as a conversation, is the influx of providing transportation to day programs that has happened post-pandemic. And so want everybody to be kind of prepared for that conversation next month. I have requested kind of some updated data from some of our larger agencies on the call about the number of trips, like a month time of number of trips, and what day programs you are typically going to. So day program, number of trips to that within the month, so that we can get a better idea of how this is affecting our overall ability to provide services. And what does that look like? Also, what kind of resources were available in the past that are no longer there post-COVID? And how do we adapt to that through, coordination, providing more resources, figuring out, how do we overcome this sort of challenge? One of the biggest issues that I hear from clients is they really struggle booking a ride between the hours of 8 and 10 every morning, or between 1 and 3 in the afternoon. because our transportation providers are so taxed picking up people and taking people to day programs and then taking them back home at the end of the day. So we've really limited through those through that change that occurred after the pandemic, limited the amount of transportation available to just the general public during those hours. So I want us to talk through some coordination opportunities, talk through, you know, what your problems are, how can we address them, who do we need to bring to the table to start tackling this challenge for folks.
Fantastic. Any other items that we need to discuss? No? Okay. Well, seeing none, we will adjourn the meeting. It is 10:41 according to the clock here we have in the building. So meeting is adjourned. We will see everybody next month. Be safe. Enjoy the 4th of July holiday weekend, and we'll see you soon.